Hi friends, good evening, and we'll see important points for the exam. This is the video number 43 of important points section. Directly we'll see the points. First one, the muscles used in normal quiet breathing is intercostal muscle and diaphragm. So the muscles for breathing, the muscle which help for breathing is intercostal muscle and diaphragm. And the next point, the amount of air passing into and out of the lungs during each cycle of breathing is called tidal volume. That is, the amount of air passing in and out of the lungs is called tidal volume. And the next point, normal tidal volume at rest is about 500 ml. And the next point, the largest volume of air which can be expelled from the lungs during maximal expiration is called expiratory reserve volume. That is, the largest volume of air which is expelled from the lungs during expiration, that is called the expiratory reserve volume. And the next point, excessive watery exudate from the nose is called rhinorrhea. And next point, infection of the alveoli is called pneumonia. And the next point, the dome-shaped muscular structure separating the thoracic and abdominal cavity is called diaphragm. So diaphragm is a dome-shaped structure which separate the thoracic and abdominal cavities. And the next point, the term used to describe the ability of the lungs to return its normal shape after each breath is called elasticity. That is, after each breath, the ability of the lung to be its normal is called elasticity. And the next point, the measures of the distensibility of the lungs is called compliance. That is, the ability to stretch and expand of the lungs is called compliance. And the next point, the causative agent of diphtheria is Corynebacterium diphtheriae. And the next point, the type of asthma which is most common in children is atopic asthma or extrinsic asthma, is also called extrinsic asthma, which is most common in children. And next point, the type of asthma which is most common in adult is non-atopic asthma, or also called intrinsic asthma. So extrinsic asthma in children, intrinsic in adult. Blood vessels which transport blood away from the heart is arteries. That is, the blood goes away from the heart through arteries and into the heart by veins. And three layers of arteries are tunica adventitia, tunica media and tunica intima are the layers of artery. And the pacemaker of heart is known as SA node. And next point, the left atrioventricular valve of the heart is called bicuspid valve or mitral valve. That is, left atrioventricular valve. And the right atrioventricular valve is known as tricuspid valve. So the left atrioventricular valve is mitral valve or bicuspid valve, and the right atrioventricular valve is known as tricuspid valve. And the next point, the arteries that form a link between the main arteries supplying the area is known as anastomosis. And the next point, the blood circulation was discovered by William Harvey. And the next point, the three layers of heart include pericardium, myocardium and endocardium. These are the three layers of heart: pericardium, myocardium and endocardium. And the next point, blood vessels that returns blood into the heart is known as veins. And next point, the network of blood vessels which supplies blood to the outer layers of tissue of thick walled blood vessels is called vasa vasorum. So this is a network of blood vessels which supply blood to the outer layer of the tissue of thick walled blood vessels, that is known as vasa vasorum. And the next point, who discovered the SA node, sinoatrial node, that is Keith and Feck in 1907. And the next point, the amount of blood output per ventricle per beat is called stroke volume. And the next point, the heart is supplied with arterial blood by coronary artery. Coronary artery supply blood to the heart. These are the important points of the day.